Hello, this presentation is on childhood immunizations. Immunizations are used to protect against infectious diseases. They are the most effective method to create a highly immune population at large. Universal vaccines are the ultimate goal. Vaccines can carry risks, but the risks of the disease are much greater. And I think that's a big controversy today, is that many parents don't want to give their child, say, the MMR or any of the other vaccines. But especially now with younger parents, they've never seen mumps, they've never seen measles, a child death from measles, or the effects of having polio. Some of those diseases come back. Certainly, they have them still in third world countries, but they've even improved with getting vaccines. So while it's always your right to refuse, um, it is something to always consider. So here are some definitions. Vaccines are whole or fractionated microorganisms. Killed vaccines versus live vaccines. Toxoids are bacterial toxins that have been changed into non-toxic form. And vaccinations are any vaccine or toxoid. With immunizations, you have active, which is a response to infection or administration of a vaccine or toxoid. Passive is conferred by giving a patient preformed antibodies, which are immunoglobulins. Unlike active immunity, passive immunity protects immediately but persists only as long as the antibodies remain in the body. With specific immunoglobulins, the preparations contain high concentrations of antibodies directed against a specific antigen. They provide immediate passive immunity, but of course that only lasts as long as the antibodies last, and that is why we have to get titers, such as with hepatitis B or your MMR, and preparations are made from donated blood. Reporting vaccine preventable diseases is part of what is done with the health department. It helps determine whether an outbreak is occurring. So you will hear sometimes that there's an outbreak of measles in a specific area, outbreak of, say, hepatitis A in a specific area, and then those things are looked at quite closely. They're used to evaluate prevention and control strategies and to evaluate the impact of national immunization policies and practices. Immunization records. The National Childhood Vaccine Act of 1986 requires a permanent record of each mandated vaccination with the date, the route, the site, the type, the manufacturer, lot number, expiration, especially if there's going to be any recall of a batch of vaccines. This is very important to keep this information. The name, address, and title of the person administering the vaccine, and reason for record to ensure the appropriate vaccine was given and to avoid over vaccination, and like I said, in case there's any recall. Now you'll find that many, especially vaccines for children, the free vaccines, it's a computerized system that um, can track um, usually a whole state. It might still be by region where you live, but say in California, we can track along most of the state and get a child's vaccinations and their records printed out, and then any vaccines that are given at your place of practice can then be added to that record. So it's a very convenient system, usually only through certain large entities Public health, of course, um, you may not find that at small doctor's offices. They may still be giving you a record, a printout record that would be added to the the registry, state registry. What are some of the adverse effects of immunizations? Immunocompromised children are at special risk from live vaccines, and those are listed here. Some of the um, conditions that put them at risk. And so, then what are the target diseases that vaccines are developed for? And these are also listed here, and those are, I'm sure, ones that you are familiar with. Many of those, like I said, for the younger individuals in a population, young adults, they have not seen these conditions because they technically have been just about eradicated um, because of the vaccines that have been given. But back when, if you're young, your grandparents, great grandparents for sure, um, definitely were around when they had the polio outbreaks, um, when whooping cough or pertussis was very prevalent. And even for myself, I had measles, I had mumps, I had rubella as a child. These are some of the other target diseases and the newer ones that came out, which have helped, so especially with the like epiglottitis. I've seen one case ever, and now with the vaccines, that would be one of the things that we're not going to see on a regular basis. We definitely don't have the as big a problem with the rotavirus with the infants and small children that we used to have before that vaccine came along. With the RSV vaccine, that's definitely cut down on the number of babies that have contracted that as newborns and died from that as a newborn. Influenza is a hit or miss. The problem, of course, with influenza is that it is based on the vaccine from the year before, and development of the meningococcal has helped with the college age student. So now we're going to go through the individual vaccines. I'm not going to discuss schedules. You need to look at the schedule that comes out for each year. So the one for 2019 should be out. It will discuss how the vaccines are given, the catch-up schedules for missed doses, and for major catch-ups if the children are older than 7. Um, and there is an adult vaccine schedule also. I'm just going to highlight a couple things about each one, but it's most important that you read your text information on these and look at the schedules. So here we have MMR. There's been a lot of controversy about its link with autism, um, but it's felt that the it's more of a coincidence that autism is diagnosed around the same age as when those vaccines have been given or would have been given. Next, you have the diphtheria, tetanus, and acellular pertussis. Acellular means that it's not a live vaccine. Um, this one is one that requires boosters, um, actually lifelong. They have the first set as children, and then they're boosters in older childhood. And then technically, you're supposed to get a tetanus booster every 10 years if you have not had one. With the pertussis, it is still part of the um, vaccine as an adult because we do occasionally get outbreaks of pertussis, especially when newborns would catch it from an adult that has not been vaccinated, especially coming from other countries. That's what we've seen mostly when we get an outbreak, that we can trace it back. Now, of course, we could also trace it to those children that have contracted again from someone that wasn't vaccinated if they are also not vaccinated. You have your polio vaccine, and this is an inactivated form of the polio vaccine. It used to be alive when I was growing up, and then, of course, when I first started in practice, we would give the oral. The oral is to protect against what we call wild polio. In the United States, wild polio is virtually now eradicated. Polio was almost eradicated, but because of the big, when we had to start that vaccine with the big polio outbreaks back in the mid-century last century, um, but we keep getting some cases, especially from people that come into the United States that haven't been vaccinated and they may have the polio virus. So, but now we are able to just use an inactivated uh, injectable vaccine, and we don't have to have the oral. You will find, though, if you travel to certain countries, you may still be required to have the oral vaccine because they still have wild polio in those countries. The next is the H flu vaccine, and like I said, that's been very helpful with, say, conditions like epiglottitis and other infectious conditions uh, that have H flu as the virus involved. So it's been a very helpful vaccine. Varicella vaccine is a live attenuated vaccine. That's one of the ones that you have to keep in the freezer. Um, varicella was developed since I've been in practice. Um, there can certainly be some serious sequelae for chickenpox, most especially in the adult patient that contracts chickenpox. And one thing, if you have chickenpox outbreak in a facility such as a hospital, then they have to close units, which is detrimental to the community, that they can't accept admissions while there's an outbreak in the facility. Um, One of the reasons it was developed is that it helps from a um, economic standpoint for families. When one child gets it, usually then the next child, if there's multiple children in the family, so every few weeks another child's coming down with it. Parents have to stay home and take care of these children, so it hurts the parent from a economic standpoint. You have the children out of school for length of time, so having the vaccine has cut down on all of that um, within communities. Next would be hepatitis B vaccine. It promotes the synthesis of the antibodies directed against hepatitis B. And of course, it is not a live vaccine. It does not cause disease. Been very helpful, of course, in cutting down the hepatitis B outbreaks. We don't hear a lot about those. We still always have to be careful, of course, with those that were older, not vaccinated, and had any IV drug use to contract or through other means, but it's been a very helpful vaccine. Hepatitis A vaccine um, is given widely now. Um, we've always seen that there could be outbreaks in school settings because, of course, with um, hepatitis A, there can be a fecal oral route of contamination. So daycare centers uh, can always be a means. In the food industry, the food handlers go to the bathroom, don't wash their hands, and then handle your foods. So there's been outbreaks of hepatitis A, especially before the vaccine, with buffet restaurant um, environments. So this vaccine again has also been very helpful in cutting down on those forms of transmission of Hep A. There are big pushes for Hep A vaccinations with our homeless populations. We have seen big outbreaks occur because of the unsanitary um, conditions in the homeless communities. So again, very helpful. We have our pneumococcal vaccines, which prevent invasive pneumococcal disease in infants and children. Again, very helpful in having children get very ill and possibly dying from infections. We have our meningococcal vaccine, um, which is used with our college students, and students have there have been deaths from contracting the pneumococcal um, infections, normally seen in college students that are living in dorm type situations. There is some concern it might cause Guillain-Barré syndrome, but those seem to be unfounded, and the risk of contracting the pneumococcal infection and its sequelae, you know, outweigh, it's always a risk benefit situation there. Our flu vaccines are annually given, um, including the H1N1 subtype. It's recommended for all children between the ages of 6 months and 18 years, and but anyone can get the vaccine, um, and it's recommended. The issue, of course, with the flu vaccine is that it is developed based on the strains from the year before. So there's some anticipation of what will be out, and then based on the year before. So some years they do a really good job, some years not such a good job because there'll be different strains the next year that aren't, um, to which the vaccine is not going to be effective. Then there's the HPV vaccine, the Gardasil is one of those that has been started so that to help guard to help guard against contracting HPV during unprotected sex, because we know that the for women the PAP um, exam is conducted to detect HPV, which certain strains of HPV, not all, but a few of the strains um, have a greater propensity to develop into cervical cancer. Question 1. Which child should not receive the MMR vaccine? And the answer is C, the child with an acute lymphocytic leukemia. And we saw that in the discussion that a child with certain conditions cannot receive this vaccine. Question 2, 6-month-old baby. A parent asked about the recommended schedule for the varicella vaccine. The nurse should inform the parent that the baby may receive the vaccine at which age? And the answer is D, at 12 months of age. In question 3, which vaccine has been identified as the safest, the one for which no adverse effects have been reported? And the answer here is D, the H flu type B. And that is it for this presentation. Thank you.